we come to the stages of heart failure. Stage A, the patients at high risk but with no symptoms or signs of heart failure. As for example, patients with a history of hypertension, atherosclerotic disease or metabolic syndromes. Stage B, patients with structural heart disease strongly associated with heart failure but without signs and symptoms, that is prior MI or asymptomatic valvular disease. Stage C, symptomatic heart failure with structural heart disease. Stage D, advanced disease with symptoms and signs despite the maximal medical therapy. Now the evaluation. Definition: whether the patient has preserved or reduced left ventricular function as determined by the ejection fraction has significantly implications, with two entities being important to differentiate. Heart failure with reduced ejection fraction, that is HF, REF, and heart failure with normal ejection fraction, HF, NEF. Diagnostics. Consider the following tests in patients with suspected HF. That is the routine electrocardiography, chest X-ray with the focus on pulmonary edema, possibly cardiomegaly, plasma concentration of natriuretic peptides. Natriuretic peptides, as for example the beta type or brain natriuretic peptides BNP and NT-proBNP, N-terminal fragment of prohormone of BNP are elevated in the presence of left ventricular failure. Sensitivity may be impaired in the presence of obesity. Other causes of increased BNP include the ventricular hypertrophy, volume expansion, decreased renal clearance, hypoxia, tachycardia, and female gender. Transthoracic echocardiography. Transthoracic echocardiography, two-dimensional echocardiography with Doppler to assess the left ventricular ejection fraction, left ventricular size, wall thickness, and valve function. Based on the 2007 American College of Cardiology or American Heart Association guidelines, it is clear that one must answer the following question prior to proceeding to the operating room. Are the symptoms of heart failure new? If so, elective surgical procedures should be postponed until optimization has occurred. The patient who has a known history of hypertension, heart failure, but worsening symptoms, that is decompensation, should also have elective surgery delayed. Heart failure with reduced ejection function. The perioperative management of patients with HF, REF can be quite complex. There are several important implications for the anesthetic care. Medical management of the patient with HF, REF. Diuretic therapy. Beta-adrenergic antagonists used judiciously. Angiotensin converting enzyme inhibitors or angiotensin 2 receptor blockers, that is ACE inhibitors and ARBs, in patients who are ACE inhibitor intolerant. Now we come to the end of this part of my video lecture. We will commence the next video lecture next day.